to go and proceed in the wound bed preparation, there are some principles that we are in need here to revise it again until the concepts come for us clear. As apart from wound bed preparation, it's going to discuss the facilitation for the wound healing. So, how the wounds already healed. There are 3 types of wound healing that when happen, it will lead at the end for the wound closure. And this is what we are looking to present as apart from the responsibilities of this week. So, we have the primary intention, we have the secondary intention, and we have the delay wound healing procedure. Let's here to take the most simple and direct one, which is the primary, how the wounds primarily will heal, and this healing procedure will facilitate for us understanding where the problem happens that prevent the normal wound healing from happening. Let's to say that here we have wound, and let's to say that this is surgical wound or traumatic wound come on this way. The primary intention for the wound healing that these 2 types to wall of the wound will convert it to be close to each other, and this will facilitate the healing here. Now, how this healing can happen? It can happen by many procedures, like maybe by suturing the wounds. There will be a suture around them. So, this mechanical force of suturing will push these 2 edges to be near of each other, and this will lead at the end for the healing. Maybe by some types of dressings come here called the glue dressings. Special dressings will be here, or the stress strip dressing. That's batch come from here to here and closed each edges to each other. And this is the best one of having the primary intention for the wound healing, but we are in need to be sure that there is no any bacteria happen here. No any bacterial or microorganisms that can develop in this region, mainly the anaerobic bacteria, which is when accumulated, and this one come to be closed, this accumulation will allow it to start to make further destruction and infection. This is what happening usually with the surgical site infection. When we have amounts of bacteria coming and prevent the primary wound closure or primary intention for the wound healing, and it will end by massive negative results. The second way for the dressings, that when the body unable to have the primary wound closure, in this way there is some tissue loss. Look for this wound, and this is our concern here, pressure ulcer or pressure injury, or maybe this is burn, or any wounds that the only way for healing it's by producing new tissues coming on this region, and these tissues will fill all this space, and this will be the granulation, which is the only option that available for this kind of wound to be healed. The granulation will come here and produce these kinds of tissue. But To accelerate this development, we are in need for dressings or something that will allow this development from happening. And as we discussed in the previous weeks, this is not the only best scenario for the wound or the pressure ulcer. Maybe we are in need for type of dressings that allow this to happen, but the nature of the pressure ulcer happen in this way. There are so many fragments here, like this is tunnel. Here, this one undermining, and so on. So until we will allow for the granulation to start to develop in this region, we should assure that we are dealing with this area in a proper way, in a way that prevent bacterial growth and allow the granulation to happen. This is the primary way that describe our concern of how the pressure ulcer or pressure injury will healed by using these complex materials or procedures. The third category, which is happen by using the delayed wound healing, which happen by using the skin graft, grafting, or flab, etc. This is the third way, and this is not part from our concern, and it's most repeated procedure, and it's a most repeated procedure as it's happened primarily in as a plastic surgeon procedure.